Well, thank you, and good morning, everybody. Thanks for joining us today, and good to see you all. So we have two important developments this week I'd like to cover. The first is that the Snohomish County Vaccine Task Force will be opening the seventh mass vaccination site in Snohomish County at the Ashway Park and Ride, which is located at 16327 Ashway in Linwood. And this new mass vaccination site will open tomorrow. Like all our other vaccination sites, reservations are required. So we have a website we'll post a link to. There's also the call center, which is 425-339-5278. So two ways to schedule a reservation. Also, residents have two ways to access the site, either as a drive-through or a walk-up location. So transit riders can ride the bus and they will be directed to the walk-up vaccination station and waiting area. So anybody, though, who arrives in a car will use the drive-through vaccination station. We really don't have the capacity, and the location is not designed for on-site parking for walk-up appointments. So again, transit riders can take a bus to the transit center and use the walk-in site, and auto drivers can use the drive-through site. So the Ashway site was planned in partnership with Community Transit, which has information available on how to access the location, also using public transportation. And again, we'll post a website link to how to hook up with that information from Community Transit. Community Transit operates 17 bus routes that directly serve the Ashway Park and Ride, as well as many other routes throughout the county and the region that require only one transfer to get to the vaccine clinic. So this is going to be a very accessible site for many, many people. For those who are newly eligible, we want to encourage you to first reach out to your primary care provider or your local pharmacy. If there are no appointments, then please do sign up at one of our mass vaccination sites. So we want to take advantage of that capacity that is going through pharmacies or healthcare providers. And then if you cannot hook up with that, get an appointment at our vaccination site. So it's recommended. Demand is still stripping our supply from the state and federal governments. So that remains a bit of a problem, but we're trying to get our vaccination sites spread around the county so we're really accessible to everybody as best we can be. The second major development this week is the launch yesterday of Snohomish County's Emergency Rental Assistance Program, or ERA. This is in partnership with Volunteers of America, Western Washington, and other key organizations. Really, since the beginning of the pandemic, economic impacts have had widespread and profoundly negative consequences for many in our community, and we recognize that. Really, in every neighborhood across the county, there are families in need, and we want to ensure there isn't a wave of evictions when the rental moratorium ends. The eviction moratorium that has ensured that people could stay in their homes, but many are behind on rent and run the risk of being evicted when the moratorium ends. The ERA is directing rental assistance to those in greatest need who have been impacted because of income loss or other factors caused by the COVID-19 pandemic. To be eligible, households must have an income of at or below 80% of area median income, have experienced a financial hardship directly related to the COVID-19 pandemic, and are at risk of experiencing homelessness or current housing instability. Further, the funding requires the following. We must give priority to households at or below 50% area median income, so they will be given priority, and households with one or more individuals who are unemployed and have been unemployed for 90 days before applying for the assistance. We really couldn't do these programs without the federally funded programs and the support from the congressional delegation. We really appreciate their continued leadership to provide these vital resources. So that's been gratefully helpful to our communities, and we're very thankful to our delegation. So in order to access the emergency rental assistance, residents should call 211, our 211 system. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Well, thank you, Executive Summers, and good morning, everyone. I'm going to start by just showing a few of our usual graphics just to update everyone on what's going on in Snohomish County with respect to COVID cases. So you should be seeing that now. And this first slide is the number of cases per week. Each one of those bars is a week in time, extending all the way back to the beginning of the pandemic. And as you can see, I'm very concerned and regret to report that it looks like we're on our way up a fourth wave of COVID here in Snohomish County and throughout the region. Looking at those last 2 weeks, those last two bars, you can see we have 1,700 new cases during the 14-day period ending Saturday, April 7. That's up substantially from the analogous two-week period from a month ago when we had just 700 cases. So that's more than doubling in less than a month. While we're on this graph, I just want to note one procedural thing. Our case count and rate figures now include not only PCR positive cases, as they always have, but also symptomatic people who tested positive at a point of care with an antigen test. We made this change to better align with the Washington State Department of Health's data dashboard. So the antigen positive cases in each one of those bars are the little blue ones below. So effective yesterday, the weekly case count update on the Health District website now includes a bar chart like this with total positive cases for the week broken into the PCR, the green on top, and the antigen positive, the blue on the bottom. They're all real cases. And, so we should be counting them. And the rolling 2-week case rate has also been updated to incorporate those. I'll show you that in a second. But this recalibration has resulted in a small increase in the total number of cases counted and in the case rate, but no change in the overall magnitude or trajectory of our past or current situation. This addition of antigen positive cases, again, I want to emphasize, is not what is driving the observed increase in the rolling 2-week COVID case rate, which I'll show you now. The overall increase in case rates is due to increased transmission, not due to some counting or surveillance artifact. Only 18% of confirmed cases over the past month are antigen positive cases. And you can see our rate now exceeds 200 cases per 100,000 in the 2 weeks leading up to April 17. That's a 250% increase over our March low of 85 cases per 100,000 per 2 weeks. And it is a amazing and impressive, but also alarming reminder how this virus can unravel all of the progress we made in just 3 to 4 weeks. An increase in COVID hospital census has also occurred. The census is the total number of people in the hospital due to COVID, and that's up to 39 yesterday from 31 last week. You may remember back in the middle of March, we were down at about 15 to 20 cases in the hospital at any one time. The COVID hospital admission rate, that is new admissions to the hospital, for the week ending April 10 was 3 per 100,000 per 7 days, up from 1.5 again in mid to late March. The majority of hospitalizations now are among individuals under 60 years of age, whereas before they were over 60 years of age predominantly. This count that I'm sharing with you includes only patients for whom the reason for admission was COVID. They were admitted because they were too sick with COVID to stay at home, including all COVID cases that are admitted to the hospital, both the ones that are there because of COVID, as well as those who have COVID or are COVID positive, but are there for another reason, labor and delivery, injury, accident, heart attack. If you add all those in, the figure is 4.6 per 100,000, which is the metric the state tracks for phase placement. And that's also approaching that threshold for phase 2. The rate for hospitalizations through April 17 is likely to approach or exceed 5. Age-specific case rates. So we're going to take this curve and now we break it down into the age groups roughly by decade. And we can see that case rates are up in all age groups, but particularly the younger adult age groups, 20 to 29 here in gray, 30 to 39 in yellow, and 40 to 49 in blue. And so that's what's leading the charge. Fortunately, our older adults have a flatter increase, and school-age kids and adolescents are in the middle. Overall, this data highlights three important things. Before I get to that, just to show you where hospitalizations are going. These were new hospitalizations per week for people who had to be admitted for COVID. And you can see we bottomed out in the low teens and now are going up. So, you know, the vaccines are working, that all of the efforts of the county and DEM, the health district, fire, all the partners working there. You know, we've got 50% of the population now almost having started vaccination, and about a third, about 25%, excuse me, it's 36% of the population that have started vaccination and 23% that have completed it. So that's working. That's helping stem the spread. And we're also seeing more and more individuals over age 65 getting vaccinated. So we're seeing less hospitalizations with this increase in that older age group. But COVID is still causing serious health concerns for our residents, as you can see from the hospital data. And age is not the only risk factor for hospitalization or even death. I will say we haven't seen any surge in deaths yet, nor in long-term care cases, but still COVID is circulating very much in our area. It's increasing. And as we've been saying, we're far from being out of the woods. We've made great progress with vaccination, but we're just not at a point where there's enough immunity in the county to prevent these kinds of problems. And I'm going to try to stop sharing there. Great. So seeing that we are now over 200 cases per 100,000 residents in a 2-week period, and hospital rates are increasing but have not eclipsed the threshold for phase 2 of 5 hospitalizations per 100,000 per week. So that puts us on the threshold and in serious jeopardy of sliding back into phase 2 again. And unmitigated, these trends could land us back in phase 1 not long thereafter. If you look back at the third wave, either in terms of cases or hospitalizations, it took us just 3 weeks to get from where we are now to rates that would drive us back into phase 1. So I think regardless of the specific numbers or the fact that we precariously remain in phase 3, the level and trajectory of cases and hospitalizations in Snohomish County and throughout the region, frankly, is going the wrong way. For those who are wondering why the numbers are going up despite the vaccine rollout having such success, I think a quick scan of social media feeds is a good qualitative indicator. We just got too many people getting together in gatherings with friends or family members who aren't fully vaccinated, aren't wearing masks, and aren't keeping their distance, and often doing it indoors to boot. The great weather over the last few days or week or so has likely helped get people to take their gatherings outside, so that helps. But even outdoors in the fresh air, masks are a must when you are not with household members or fully vaccinated individuals. To top that off, the virus is fighting back. We have an ever-expanding proportion of cases accounted for by more transmissible variants like the B.1.1.7 and the B.1.429 variants that now are the two predominant circulating strains and that are transmitted roughly 50% more easily than the previously circulating strains. So we have even less margin for error or gaps in our prevention measures with these circulating strains. And it's time for everyone to step up their efforts in terms of mask use when outside the home, avoiding gatherings, especially indoor gatherings, keeping indoor spaces well ventilated, and patiently but persistently looking for that opportunity to get vaccinated. If we start this approach right away and we do all these things well in our personal lives and with elective activities, I think we may have a reasonable chance of avoiding the necessary tighter restrictions that would result, and in the past have choked the economy and other aspects of the community and public life. So going back a phase is painful and carries a heavy toll for many. Back 2 phases, even worse. But that's where we're headed within the next few weeks if these numbers don't turn around. It's happened before, and it will happen again if we don't change course. We're in a race against this virus, and reducing our exposure risks buys more time for all of us to further extend the vaccination coverage to a point where a 4th or a 5th wave is preventable, and we can begin to reach a new normal with a lower level of guard against the virus. But we're not there yet. On the vaccine front, I mentioned 36% coverage with at least the first dose of Snohomish County residents, 23% completed. If you change the denominator to adults, excluding the children who are not yet eligible, then we've got 47% of adults starting vaccination and 30% having completed it, respectively. Again, speaking to the efforts of the mass vaccination sites, as well as our healthcare system, pharmacies, and other partners. This week, we will be approaching our 500,000th dose administered in Snohomish County. It's quite a milestone. Vaccine supplies look to be pretty similar to recent weeks. The data I saw yesterday showed we have 55,000 doses coming to the county this week, roughly split between the 2 Pfizer and Moderna products and the first and second doses. We're continuing to monitor the Johnson & Johnson situation as the CDC and FDA continue their review of available information that led to the interruption of its use last week. To share more about efforts by the Snohomish County Vaccine Task Force, I'll turn it over to the county's Director of Emergency Management, Jason Bierman. Jason.
Thanks, Dr. Spitters, and good morning, everyone. Just want to add a couple of details to what's been shared. One of the things, as Dr. Spitters talks about the need to get vaccinated, and just a reminder to everyone, that really is the key to this, getting vaccinated, continuing to wear your mask. But we've heard and want to share the strategy to ensure that there's access for folks around the county. So Executive Summers mentioned opening Ash Way. It is our 7th site. And this is all part of a strategy to ensure that we have accessibility for residents in Snohomish County. We now have sites in North County with Boom City and the Arlington Airport, in East County with Monroe. We have the Ash Way site. We have the Boeing Activity Center, Angel of the Winds. So we have sites around the county that are fixed facilities, places where folks can come in and now either by car or walking in, or in the case of the Ash Way site, either, including arriving by transit. So we're trying to make it convenient and accessible for folks to be able to come to these sites and to be able to get their vaccine. We're also doing work out in the communities. We have had mobile teams operating now since January, teams that have gone out to access senior centers, folks who are going out to access homebound individuals. Certainly, if you know someone who is homebound, or if you are homebound, you can access the same number, the call center, and let us know that you're homebound and unable to get out to get vaccinated. And we will work to ensure that you get vaccinated in your home. We also this week are starting with the process that began last week in terms of community-based organizations and their ability to reach out to us and establish community-based vaccination, small community-based vaccination clinics. We'll be doing the first one of those this week in partnership with the Snohomish County Latino Coalition. So we are working really hard, our team, our partners with the health district, with our fire and EMS community, with private partners like Seattle Visiting Nurses, and many, many others, to ensure that there's accessibility for Snohomish County residents so that they can come in different ways and get vaccinated, which really is, again, the key to bringing the pandemic to an end, or at least preventing us from sliding backwards in terms of the phasing. The last thing I just want to reiterate as well, we We know that there are a lot of folks who want to get vaccinated. There's a recent survey from American Community Survey that indicates, or at least through their survey, 88% of the adults in the county want to get vaccinated. We want you to get vaccinated. We're trying to make it accessible and easy for you to get vaccinated. As Dr. Spitters indicated, the vaccine forecast for the next 3 weeks is pretty steady. So we will be working with about the same amount of vaccine, but we're ready when more vaccine arrives. And with the vaccine we have, we feel very good about how efficient the sites are. We appreciate the feedback we're getting from lots of folks who are finding it very easy to get through the drive-through and walk-in sites and get vaccinated quickly and efficiently. So we're ready for more vaccine. We certainly want folks to come take advantage of the vaccine that is available now with 7 sites, mobile teams, community-based vaccination clinics, and of course, the work that's being done by all of our other healthcare system partners. We think we've got lots of different avenues where folks can come in and get vaccinated, so please do so. And with that, I'll turn it back over to Executive Summers.
Thank you, Jason. Thank you, Doctor. First question, I think we've kind of covered, but are you saying Snohomish County is likely to drop to phase 2 May 2nd? And I think Dr. Spitters covered this, but we are in danger of going back to phase 2. We're starting to exceed some of the criteria, but we have time. We have several weeks to turn this around. And hopefully with the good weather we've had this week, people are getting outdoors, but we've seen previous spikes and peaks be rather sharp, and we can turn this around if people just take action, protect themselves, don't gather, particularly with groups of unvaccinated people indoors. We can absolutely turn this around before the next decision point. So it's not inevitable that we'll go into phase 2, but if we don't turn these trends around, that's a likelihood. And Doctor, I think for you, when do you expect vaccinations to start making a dent in the case and hospitalization rates?
Well, I think they already are making a dent, and the numbers I showed you would be worse if we didn't have the vaccine coverage we have now. It's just not good enough to, really eliminate sustained transmission, which is our goal. Our goal is to have it so that when the virus tries to jump from one person to another, it can't find someone who's susceptible. And that's not yet the case. It's certainly finding far fewer susceptible people than it would have, 3 months ago. I think these curves would have been even worse by now, given these variants and their, greater propensity to spread between people. So we're already making a dent. But we need to go further. I think, since we haven't been here before, all we have are estimates of what it would take to really fully interrupt sustained transmission. And those estimates tend to range around 80% plus immunity in the community between either vaccination or prior infection. And we're well below that.
So many doctors have said that our current situation is similar to a race between getting people vaccinated and the spread of variants causing a forced surge. Based on the data you showed us, is the spread winning the race right now?
Well, it's a fair question, and qualitatively very similar to the one I just answered, which is, first, I don't know, who's winning. We would be doing a lot worse if we didn't have the vaccine coverage we have now, but we've got to do better, both in terms of preventing transmission with the old methods that we've been using for a year now, to buy time to get to that point where maybe it could be the new normal to have quite a bit less of that type of prevention activity, but we're just not there yet. So the fight's still on, the race is on, and we've got to keep running it, but it's not, we need everybody to chip in, not only by getting vaccinated, but to doing those things that Executive Summers mentioned, particularly avoiding indoor gatherings with unvaccinated people. It's just, not a good idea right now, and it's not good for individuals or the community.
So considering supply is not increasing, are there fewer appointments at other sites? How are you able to open up more sites despite not seeing a significant increase in supply? And Dr. or Jason might want to address this.
Yeah, I can respond to that. Yeah, sometimes that does mean the number of appointments goes down. We do work closely with the health district to distribute the allocation equitably around the county in terms of location and also in terms of the different modalities to make sure that there is an allocation that goes to our mobile teams, that there is an allocation that goes to the community-based smaller clinics, and then of course what goes to our mass vaccination sites. How we're able to set up the 7th site, these have been planned again for months, going all the way back to late July, early August. Why we're setting them up, as I mentioned, it's to ensure we have distribution around the county. I think we all believe that vaccine availability will increase. I know we've all been waiting patiently, or in some cases, not so patiently, certainly in my case. But when it does increase, we're going to have coverage around the county. And so part of it for us is getting these sites open, getting the processes well established so that when more vaccine arrives, it flows even more smoothly and these sites are already up and used to running. And we're not starting on day one with a lot of vaccine immediately. So it's sort of I wouldn't say it's a soft launch, but it's a rolling launch to ensure that we've got processes and systems and locations that work well before lots and lots of vaccine arrives.
I would think it's fair to say that supply has increased somewhat, not as much as demand, but I can remember just a few weeks ago, we were at about like 17,000 doses for a week. And this week, Doctor, I think you mentioned we're over 50,000. So there has been an increase in supply. It's not steady and it's not consistent, but and it's not adequate for the demand, but we are doing better. And we do want to make sure everybody has access. So again, moving the sites around the county, making those options available to people around the county is important for us. Has the state given an update on the Johnson & Johnson situation? If guidance were to change this week, how quickly could the arena site be put back up and running?
Well, maybe that's an opportunity just to try to give a brief update on the overall situation. So again, about this time last week, CDC and the FDA said, hey, just put use of the Johnson & Johnson vaccine on hold while we look into these rare episodes of these blood clots happening in the veins that drain the brain. And quite a serious condition, but extremely rare. So the Advisory Committee on Immunization Practices, which is CDC's advisory body that makes reviews data and makes recommendations for all vaccines used in the United States, met last Wednesday. They looked at the data available and decide, the question before them was, do we need to change, make any changes in how we're using this vaccine? And then the second question was, does the committee have any additional recommendations based on the data they've seen? So they looked at it and they said, we're not ready to answer either of those questions. We need more information about the cases. I think they want to look at more information about the AstraZeneca situation in Europe, which is physiologically somewhat similar to what's been observed with these rare cases in the US. They also wanted a little bit of time to pass to see if more cases arose here in the US and to dig a little deeper, I think, into the medical information around those specific cases that have occurred. So my understanding is they assigned the CD staff, go do it, go get that information. And I think also to draft a risk-benefit analysis for the committee to then consider at a later date, roughly 2 weeks from their last meeting. So I don't think we'll see, any news on this in terms of updated or interim guidelines or further, for a sort of a request for further time until middle or end of next week. And then it's probably going to be another week for that guidance to reach implementation. So I think we're still a couple weeks off from whatever we're going to do with the Johnson & Johnson vaccine from there, and how we're going to use it. And then I would defer back to Executive Summers or Director Bierman about what the impact of that would be on Angel of the Winds Arena.
Jason?
Yeah, Angel of the Winds could resume operations quickly, but there's also the ability to utilize Johnson & Johnson or the Janssen vaccine at other sites as well. So we have some flexibility built into our sites. So when Johnson & Johnson returns in terms of availability, we'll be able to use it quickly.
Thank you. Okay, now that more people are getting fully vaccinated, they don't seem to want to follow certain safety measures despite rising case counts. What do you think the next few months will look like in terms of masks, distancing, and capacity concerns? And when might we see a crowded indoor space without masks?
Well, I think, the best thing, this raises the question, what's a reasonable way to conduct oneself at home and in the community when one is fully vaccinated? And so if you're at home and you're fully vaccinated, you can meet with other people from outside your home who are fully vaccinated and do that without mask wearing. And you can, have small gatherings of, getting together with a friend who's vaccinated. If you're getting together with a family or friends who's not vaccinated, and it's just one other household, you can let the mask go if those other people who are unvaccinated are not at high risk, meaning, for instance, older than 65 or underlying medical conditions. Frankly, I think that's a lot to keep track of. And my personal advice, that's simplified, is if you're with other people who are all vaccinated indoors, that's okay. If somebody's not vaccinated, just wear the mask. Then outside the home, it's a different thing. First, there are rare, albeit rare, breakthrough cases that can occur in vaccinated people, larger crowds in public spaces. We don't want to, give this virus an opportunity to have, nature select for a strain that's less and less and less controlled by the vaccine. So I think until we reach a time where we've really got the genie back in the bottle and a substantial majority of the population is vaccinated, we're all going to be trying to distance and wear masks in public settings, indoor or outdoor, for the macro effort to try to, again, get that genie back in the bottle so that then everyone can enjoy a new normal.
Yeah, just to put an emphasis on that, we really are asking people, whether you've been vaccinated or not, continue wearing masks, continue to take the safety measures, distance yourselves, particularly from unvaccinated people. But as Dr. Spitter said, that even if you're vaccinated, there's a chance, even a probability, although lower, that you can get the virus, carry the virus, and spread the virus. And so we need to shut that door by wearing masks and socially distancing. And as the doctor said, if you're one of the rare cases where you are susceptible, you have been vaccinated and are susceptible, and the virus gets hold, that encourages the virus to continue to produce in that way, reproduce, and it creates the option and the ability or opportunity for the virus to create a new strain that's more resistant to the vaccine. So we just need to keep our protection measures going and continue this until we tamp this thing out. It's just like a fire. You don't want to let this smoldering embers catch hold and start another fire. So anyway, let's see, vaccines are down a bit from a few weeks back, and now they're holding steady. Has the state said if they've heard from the feds when they'll go back up, not counting the J&J pause?
We just have that three-week visibility, and I think that's all the state has. I think they tell us what they've got, and we've got a stable allocation going forward 3 weeks, no better, no worse than the current week, and that's all they know, and that's all we know. There certainly is the promise of augmented supplies going forward, but for right now, I think we just count on that roughly 50,000 doses a week coming to the county.
I think that wraps us up.
This is Kristen in the Joint Information Center. Thank you for joining us today. Please stay tuned for future media availabilities.
And I do want to thank Kristen for her work here. She's leaving this arena and going to work as PIO at Paintfield. So thank you, Kristen. We just really look forward to continuing to work with you in another venue.
Oh, thank you, Executive Summers. I appreciate that.